Hi there, this is Dr. Bruce Mundabwaji once again, and today we are talking about uterine fibroids. What are fibroids? Fibroids are non-cancerous tumors that occur in the womb or uterus. They can be located either inside the wall of the uterus, where we say they are intramural. They can occur outside the wall on the outer surface of the uterus or womb, where we say they are subserous. In a few occasions, they can be found in the inner lining of the womb. In that case, we say they are submucosal. A few times, fibroids can be pedunculated, where they have a long stalk and they hang out of the outer surface of the uterus like a bell. Fibroids can vary in size. They can be as small as the size of a grain of maize or bean. They can be as large as a watermelon, and you know watermelon comes in various sizes. Most of the time, we do not know what actually would cause fibroids to occur, but of course, there are a few risk factors. First of all, you should be a woman, and the hormones that make us women, estrogen and progesterone, are known to be responsible for causing fibroids. Therefore, it is very uncommon that a child who has not started menstruating would have fibroids. In the same way, women who are postmenopausal or who are no longer menstruating are not likely to develop new fibroids. And most of the time, if they did have fibroids before they hit menopause, either they will stop growing, and in some people, they actually decrease in size. Other risk factors include being of African descent. It is known that those of us who are of African descent are more likely to develop fibroids compared to the other races. Fibroids are surprisingly common in some research that have come up to as much as 80% of women are postulated to develop fibroids sometime in their lifetime. If you have had a lot of children, childbearing is noted to be protective. Those who do not have children or have never had children are more prone to develop fibroids. Women who take in a lot of red meat, alcohol, are also known to be more prone to developing fibroids. Healthy diets such as a lot of fruits and vegetables and having low weight is also known to be protective. So what are the symptoms of fibroids? Commonly, fibroids are asymptomatic. You may never know you have fibroids until you have had an ultrasound scan for some other reason. If they would cause symptoms, it depends on their number, their size, and where they are located. Fibroids can be so big to the point that you actually look like you are pregnant, or people will take a look at you and realize that you have gained weight or your belly is looking bigger than it used to be. In some cases, fibroids can cause pain. They can cause pain by themselves. They can cause pain when you have sex with your partner. They can cause pain when you are pregnant. Commonly, when people who have fibroids get pregnant, the fibroid nodules undergo changes that we term degeneration, and they tend to present to hospital with a lot of pain. Sometimes the pain is so bad that they will need to be hospitalized and put on IV medication. Sometimes fibroids will cause you to bleed. You will bleed very heavily during your period, such that you may need to use pampers, and some people they use pampers or baby diapers to help control the bleeding. You bleed so much so that you have heavy clots. Sometimes even when it is not time for your period, you bleed. So you bleed during your period, you bleed when it is not your period, and in some women it is so bad that all through the cycle they are bleeding. They are bleeding all the time, so they do not know anymore when their period starts and when their period ends. And when you bleed for so long because of uterine fibroids, normally it will get to a point where your blood level or your HB level begins to drop, and then we would say that you are anemic, and the signs of anemia will start showing: difficulty concentrating, you feel tired easily, it is difficult for you to focus on various tasks because your blood hemoglobin is just too low. And in some cases, you may need to be admitted and given transfusions. sometimes you'd have to be consistently put on hematinics. In a few women, fibroids can give fertility problems. Either you will not be able to get pregnant because the fibroids are all over the place and in the way, or when you do actually get pregnant, the zygote or the embryo has difficulty finding a suitable place to implant, and they may implant all right, but then you lose the pregnancy, and so you get recurrent abortions because of the locations of the fibroids. In some circumstances, the size of the fibroid can cause pressure symptoms. If the fibroid compresses on your rectum, for example, it may cause you to suffer from constipation. Sometimes the fibroids will press on the urethra, the tube through which your urine would pass, and so you may have difficulty passing urine. You'd have to strain a lot to get the urine out. There have been instances where women have gone into urinary retention. They are not able to pass urine at all because the fibroids have completely blocked the way, and we had to put in a urethral catheter before we are able to empty the urine. In some instances, the pressure of the fibroids on the urinary bladder causes the woman to have frequency. Every few minutes, she feels the urge to go to the bathroom to empty her bladder. In women who are pregnant and have fibroids, there is an increased risk of cesarean section for two main reasons. One, because of the location of the fibroids, the baby may come with an abnormal presentation, either a transverse lie or a breech presentation, in which case she may not be able to deliver vaginally. In certain instances where there are fibroids that are low-lying such that they come before the presenting part, commonly the head of the baby, it is difficult or impossible for the woman to deliver vaginally. In that case, the woman would need a cesarean delivery. Is there treatment for fibroids? Yes, there is. But you only need to treat your fibroids if it is giving you symptoms or problems. Like I mentioned before, most fibroids are asymptomatic. You may not know you even have fibroids. So for those ones, you let sleeping dogs lie. But if you have complications of fibroids like we have discussed before, then you may need to have surgery or some other form of treatment for your fibroids. Commonly, we will give you the option of surgery, either to take the fibroids out and to leave your uterus behind, especially if you are yet to have children or if you hope to have more children in the future. But if you do not have plans of having any more children, then your doctor is likely to recommend hysterectomy, where the whole of your uterus or womb plus the fibroids are taken out. In some instances, especially when the fibroids are small, you may benefit from medication. This is more effective for people with smaller uterine fibroids. There are other high-tech treatment for fibroids, including embolization, laparoscopic surgery, and these will be discussed with your doctor and agreed on based on your symptoms and certain factors that will be considered by your doctor. In the management of fibroids, sometimes the treatment is purely symptomatic. So if, for example, your fibroid is causing you pain, we will give you pain relief. If the bleeding is heavy and giving you anemia, causing you to have anemia, we will give you hematinics to help build your blood level up. Other times, we'll give you various medications, commonly contraception, hormonal contraception, and these will help to stop the bleeding, sometimes for months at a time. There are a few oral medications that you can take to help control bleeding if you have fibroids that are giving you very heavy flow. And on that note, I'll wrap up on my short talk on fibroids. We'll continue in our next episode. Thank you and God bless you. If you pick anything of value from this video, if you enjoyed it, please like, share, comment, subscribe, and tell people about RAND and about Ruth Wonderboy, this educational video.